Hi Andrew, my name is Haley. I'm a nurse practitioner student and I'm going to be doing an exam on you today. Do you have any questions before we get started?
Nope.
I'm going to go ahead and perform hand hygiene, and then I'm going to look at his general appearance. He appears fit, he appears pleasant, he is alert and oriented, he appears to be well groomed, he has good hygiene, and he does not appear to be in any distress. So now I'm going to take a look at his skin. Looking at his face, he does have some small macules, some freckles, a small mole on his right cheek, and then looking at his arms, he does have tattoos on his right arm, and then I'm also noticing some small macules as well, and then also on his left arm too. I'm going to go ahead and take a look at his fingernails. They're nice and pink, and I am going to go ahead and check cap refill, and it's less than 3 seconds. Now I'm going to go ahead and examine his head. His face is symmetrical, it's very pleasant. I'm going to go ahead and look at his hair, look at his scalp. He has thick hair, it's evenly dispersed, he doesn't appear to have any hair loss. He doesn't have any bumps on his head, normocephalic. And I am going to go ahead and test for TMJ. So I'm going to go ahead and have you open your mouth and close it. Go ahead and open and close again. Okay, there's no crepitus. I didn't notice any cracking. Did you feel any discomfort at all?
No.
Okay. Next, I'm going to inspect his eye and the region around his eyes. He does have thick eyebrows. Looking at his eyes right now, he doesn't appear to have any eyelid edema, anything like that. I'm going to go ahead and touch your face and kind of look at your eyes a little bit. He has brown iris, both eyes. He does have a small brown speck in his right eye. His sclera is white. Cornea is clear. Conjunctiva is pink. All right, I'm going to go ahead and do a couple of eye exams on you. So I'm going to have you look a little bit past me, and I'm going to look and see how your pupils constrict. So your pupils right now, they're about 4 millimeters, and then I'm going to see how they restrict when I shine it in one eye, and look at the other one as well and see if they both constrict, and then switch to the other eye. Okay, his left and right eye both constrict, and I'm going to do the other eye. Okay, both of his eyes constrict as well. Okay, now I'm going to have you go ahead and follow my pen. Okay, so I just tested some extraocular movements. He didn't have any nystagmus. There was no lagging in his eye movements. They were all smooth. Now I'm going to go ahead and look at the structure of your eye. Typically we would have the lights a little bit dimmer so I could get a better visualization, but this is just the lighting that we have right now. So I'm going to go ahead and take a look. Okay, get a little bit closer to you. Okay, so looking at his right eye, the red reflex was present. When looking at his optic disc, the margins were sharp. It was a yellowish orange color, and I could see the vessels as well. I'm going to go ahead and look in your left eye too. Okay. Again, red reflex was present. His optic disc was yellow-orange, and I could also see the vessels. All right. Now I'm going to go ahead and take a look at your ears. Have you had any problems with hearing lately?
No.
Okay. I'm going to take a look at his ears and kind of feel them. There's no bumps or anything. They're nice and smooth. Look at this one as well. Nice and pink, no bumps or anything. Now I'm going to do a couple of hearing tests. The first one, I'm going to stand behind you and I'm going to whisper 3 words and have you repeat them back to me. Go ahead and cover your left ear with your hand and plug it. Yep.
5DF.
Okay, go ahead and cover your right ear.
K9F.
Okay, great. Now I'm going to do a test with a tuning fork where I will make a sound with it, put it on the top of your head, and you let me know if you hear it equally in both ears or if you hear it more in one ear or the other.
I hear it equally.
Okay. Now I'm going to do another test with the tuning fork where I will put it behind your ear. You let me know when you stop hearing the sound, and then I will put it in front of your ear, and you let me know when you stop hearing the sound in the front.
Okay.
Let me try it one more time.
I don't hear it anymore.
Okay.
I don't hear it anymore.
Okay, so he did hear the sound longer in the front, which means that air conduction is greater than bone conduction, which is a normal result. I'm going to go ahead and do it in the other ear.
I don't hear it anymore. I don't hear it anymore.
Okay, his left ear also, he heard it longer in the front than in the back, which means air conduction is greater than bone conduction as well. Now I'm going to go ahead and take a look in both ears. Go ahead and pull that up and back. Okay, so I do see the tympanic membrane. It is a pearly gray color. I do see the ring of light. There's no redness or swelling, and I really didn't see much cerumen either. I'm going to go ahead and check the other ear. This ear as well, the tympanic membrane was a pearly gray color. He didn't have any redness or swelling. It didn't look like there was any edema. And then not much cerumen either. All right, now I'm going to go ahead and inspect his nose. His nose appears symmetrical. He does have a freckle on his nose. It's nice and pink. He doesn't seem to have any, like, it's not chapped or anything, no redness. He doesn't have any nasal drainage either. Go ahead and inspect each ear. Okay. All right, so the turbinates were nice and pink. He didn't have any obstructions. His septum was not deviated at all. And I'm going to go ahead and look at your mouth. His lips are nice and pink. They're not dry or chapped. I'm going to go ahead and have you open your mouth. Look inside. His tongue is nice and pink. Go ahead and move your tongue side to side. Nice and pink. His teeth are straight. All right, go ahead and say ah for me. Okay. His uvula moves up. His gag reflex is present. His tonsils are pink. They don't appear to be swollen. Okay. Now I'm going to go ahead and inspect your neck, check your thyroid and your lymph nodes. Alright, so first I'm going to go ahead and palpate his lymph nodes. We'll start with the submental, the submandibular, the tonsillar, the preauricular, and the postauricular. The superficial cervical, and then the deep cervical, the posterior cervical, and then the subclavicular. And also the occipital. So his lymph nodes, they're not swollen, they're non-tender, they're freely movable. None of them appear to be enlarged. So now I'm going to go ahead and assess the thyroid. Just from looking at him, it doesn't appear that it's enlarged at all. So now I'm just going to go ahead and palpate. Okay, I'm going to go ahead and have you swallow. Okay. His thyroid moves up and down. It's nice and soft. He doesn't have, it's not more swollen on one side or the other. It's not swollen at all, so just totally normal. Now I'm going to go ahead and assess the trachea. Alright, it's not deviated at all. There's no masses. There's nothing abnormal. That is the conclusion of our exam. Do you have any questions for me?
No.
All right, thank you.
Thank you.